Chapter 10, Additional Pharmacy Practice Settings and Advanced Roles for Technicians. We'll skip over the terms and definitions here because we'll cover them in the chapter. So, as the field of pharmacy evolves, so do the responsibilities and opportunities for the pharmacy technician. The expected employment growth rate for pharmacy technician careers between 2014 and 2024 is 9%. There are several reasons for this increase in the need for technicians with advanced qualifications, such as medication safety regulations, the increasing development of new medications, and the rapid growth of the elderly population who have polypharmacy concerns. And polypharmacy is the simultaneous use of multi-drugs to treat a single ailment or condition. And that can also mean that they're using more than one pharmacy as well, which can also be concerning because then either pharmacy doesn't know what you're getting at the other pharmacy, and you could be getting the same medications to treat the same conditions. So the role of a pharmacy technician used to be considered a clerk type position. So stocking shelves, running the register, kind of back in the day in the mom and pop type pharmacies. However, the technician's role has grown into a position with important responsibilities, and most states require the pharmacy technician to be licensed or registered with the State Board of Pharmacy. In some cases, national certification is required to obtain a position as a pharmacy technician, and more than 30% of pharmacy technicians work in traditional settings, such as community or hospital pharmacies. However, with the increase in qualified experience and well-trained technicians, many opportunities at an advanced level have become available to pharmacy technicians. And I'd say probably more so as well since this book was written, definitely with the pandemic coming into our lives. Technicians applying for the type of positions discussed in the following sections should keep in mind that the more entry-level experience they have, the more competitive their resume will be. American Society of Health System Pharmacists, the ASHP, began in 2010 promoting the Practice Advancement Initiative through the Pharmacy Practice Model Initiative. The future of healthcare includes an interdisciplinary approach to ensure the wellness and overall optimum health of patients. Some of the PAI technician-related initiatives include pharmacy technicians are urged to seek non-traditional roles and advanced certifications. Pharmacy technicians should perform traditional preparation and distribution activities to allow pharmacists the time for more direct patient interaction. Leadership in advanced training or certification provides the pharmacy technician, the certified technician, with additional knowledge and skills to play a larger, significant part of an interdisciplinary team who, along with assisting the pharmacist, works closely with other healthcare team members to ensure the best overall care of a patient. So this is kind of interesting. Of the fastest growing jobs overall in the United States, the career pharmacy technician ranks number 60. It ranks number 10 for workers age 16 to 24, which that's kind of weird because I would say it probably needs to be 18 at most places, and number 22 for women. With the increasing number of medications being prescribed, pharmacies need at least one employee to do the purchasing for the department. Most commonly found in the institutional setting, pharmacy purchasing agents also can work in retail, nuclear, or mail order settings, also known as the pharmacy procurement specialist or the pharmacy buyer. The pharmacy purchasing agent has several responsibilities, including the following: placing daily orders to keep the department stocked so the patient's need can be met, meeting with pharmaceutical sales reps to discuss new and alternative medications, negotiating prices and contracts, planning ahead for the demand for certain products, establishing cost-effective practices, working closely with pharmacy management to take advantage of cost-saving opportunities, ensuring barcodes are available in integration with electronic health records and automated dispensing system. Inventory is current. Working with outside entities such as disaster planning agencies, EMS, fire safety, and public health departments to maintain specific inventories, maintaining required documentation for returns, waste, recalls, and regulatory agencies. So in most facilities, the requirement for the position of pharmacy purchasing agent usually include up to 2 years of experience as a technician and related on-the-job training. Additional requirements may include one or more pharmacy technician certifications. That's of course going to be dependent in the state. Also an associate or bachelor's degree, although not required, is often preferred. So anytime I've ever seen this job posted in the institutional setting that I worked at, it was usually taken very quickly by technicians who have been there for a very long time. This is kind of like a coveted position. And most of the time they'll say associates or bachelor's degree preferred, not required, but usually somebody that has one of those is going to get the position over someone that doesn't. Medication reconciliation is defined as the process of preparing documentation with brand, generic, and drug use information to ensure accuracy of the patient's current regimen. Other pertinent information, such as allergies, conditions, or diseases, is also included to provide a complete patient profile. Typically, this is done through an interview process with a medication reconciliation technician. The pharmacy medication reconciliation technician is an essential factor in patient safety. The goal of this position is to prevent medication errors. Adverse drug events are preventable, and according to the Institute of Medicine in a 2006 report, 1.5 million errors occur each year in the United States. This can include errors in dosing, amount of times, wrong drug, or interactions with food or other drugs. Performing medication reconciliation can prevent drug omissions, duplications, errors in dosing, and drug-drug interactions, as well as ADEs. Since 2009, the process of medication reconciliation has reduced medication errors to less than 5%. The step-by-step process is as follows: developing a list of current medication, developing a list of medications to be ordered or prescribed, comparing the information on the two lists, making clinical decisions, communicating the new list to appropriate individuals. So actually did this job for like 3 years in the hospital that I worked at. It's definitely a job for a more experienced technician. We did have some technicians who came pretty early on in their career. And I mean, they were able to do the job, but it was a little bit more of a struggle just because in the beginning, you don't know all the medications as well. You don't know all the therapeutic duplications. And a lot of the patients don't know what medications they're taking. So it can be a little bit of a stressful job. The technician's responsibilities begin with interviewing the patients about their at-home medications, including prescription and over-the-counter medications, vitamins, and herbal supplements. This can be done in the emergency department prior to admission, during a preoperative registration for a procedure, or upon discharge. The list should include the drug name, dosage, frequency, and any notes included with the medication. The technician may have to call different sources to get all the information required to complete each patient's list. Calls are frequently made to pharmacies, prescribers' offices, long-term care facilities, and other healthcare settings. Once a patient's list is complete, the technician is responsible for entering the information into the computer system, being careful to avoid any errors so that it is available to the healthcare provider. This information helps the provider make informed decisions about the patient's medication regimen. So although education is not required, additional education is not required for this position, it's always an advantage if you're certified. Obviously, in certain states, it's required. You should be familiar with medications, possible side effects, and drug-drug interactions or food-drug interactions for this job. Also, just keep in mind that the hospital that I worked at, everything I did had to be checked by the pharmacist before it was readily available to the healthcare provider. So, um, don't think that like someone's not going to at least check your work. I know that made me feel a little bit better. And some of the things that I wasn't 100% sure of course, I could just go and ask them. As a result, the pharmacy technician should have significant experience in the pharmacy field. Medication reconciliation technicians also must have good communication skills and a strong sense of professionalism because they communicate with the patient in person. Prior approval or investigational drug coordinator. This position can be a separate job or part of the med rec technician position, as certain medications require special documentation prior to dispensing. So I can tell you that in my job as a medication reconciliation technician, we did not do this. The technician must maintain inventory, keep records, and under the direct supervision of a pharmacist, work directly with manufacturers, physicians, nurses, and patients on a daily basis. Patients who participate in a study or clinical trial have to be located and require extensive interviewing and medical history documentation. Medications needing prior approval can require prior regimens of other trials or less expensive medications. This may be due to third-party requirements, manufacturer recommendations, or the inability of the patient to afford the medication. In all of these cases, a working knowledge of pharmacology, a basic knowledge of data entry, and good writing and communication skills are needed. So I did actually do a job at a specialty pharmacy as a prior authorization specialist. So I did do this kind of job separately from the medication reconciliation. So it involves talking to doctors' offices, insurance companies, patients to an extent, but it was more interaction with the insurance company and the doctor's office. The definition of managed care is an organized healthcare delivery system designed to improve both the quality and the accessibility of healthcare, including pharmaceutical care, while maintaining cost. Most elderly patients take multiple medications, increasing the need for the management of prescription drug use. As a result, pharmacy benefit management companies were created. The purpose of PBMs is to develop and manage broad and cost-efficient prescription drug benefits for a large group of patient populations. The responsibilities of a pharmacist in a PBM setting include building formularies, creating drug benefit plans, and negotiating contracts with community pharmacies. The role of the pharmacy technician in this setting varies even more broadly. Managed care pharmacy technicians work mainly in an office, and their responsibilities include the following: provide benefit information to the patient or client, determining the proper use of benefits, retrieving and entering clinical data, processing claims for members according to their benefits, troubleshooting rejected claims, entering and preparing mail order prescriptions. Another specialty area for a pharmacy technician is education and or training. An experienced pharmacy technician can take on a role as an educator at an accredited school or lead training for new pharmacy employees. As a pharmacy technician trainer, a technician must have adequate experience in the practice area he or she is teaching. A trainer's responsibility is to provide the on-the-job training for new employees or for new technicians in new roles. The training usually continues until the trainer and the new employee both feel confident about the new employee performing the tasks needed in a pharmacy with minimal supervision. The pharmacy educator is most commonly found working for an accredited college or university, either on campus or online. So, me. Some community pharmacies do offer a training course that is certified by the ASHP and differs from on the job training. Walgreens and CVS do offer this. The responsibilities of pharmacy technician educator include teaching pharmacy technician students the knowledge and skills they need to pass an ASHP approved national certification exam and become certified pharmacy technicians. Subjects taught by pharmacy technician educators include, which this is everything we're going to learn and more probably, personal, interpersonal knowledge and skills, foundational professional knowledge and skills, processing and handling of medications and medication orders, sterile and non-sterile compounding, procurement, billing, reimbursement, and inventory management, patient and medication safety, technology and informatics, regulatory issues, and quality assurance. So technicians interested in a rewarding career as a pharmacy technician educator must have national certification, meet their state's regulations for practice, and have a minimum of 3 years in the pharmacy setting. Most employers look for candidates with retail and hospital pharmacy experience, and individuals with an associate or bachelor's degree tend to be more competitive. Although a pharmaceutical sales rep career is more of a non-traditional setting for a pharmacy technician, it does have its advantages. So to be honest, I've never really known technicians to go this way personally, but that doesn't mean they don't. The pay for a pharmaceutical sales rep is significantly higher than that for pharmacy technicians in a traditional setting. According to the Bureau of Labor and Statistics, as of 2015, the median salary for a pharmacy technician is about 30,000, growing at 9% annually, and the median salary for a pharmaceutical sales rep is about 92,000. Most pharmaceutical companies offer their employees a company car and great benefits packages. But just keep in mind, this is a sales position. So um, your pay is more than likely going to depend on how much you can sell. The responsibilities of pharmaceutical sales reps include traveling to the client's sites and promoting their assigned medications. The representative should have on hand important information on the medication he or she is trying to sell, including up-to-date reports on clinical studies and side effects, in addition to a pharmacological knowledge of the drug. The ultimate goal of a sales rep is to do everything possible to sell specific products, often by persuading the buyer that the products are the best on the market. The requirements for a pharmaceutical sales rep include an associate's or a bachelor's degree in fields such as biology, chemistry, marketing, business, or related field. And I can tell you that definitely you probably will not get a position as a pharmaceutical sales rep without a bachelor's degree. As defined by the Department of Pharmacy Practice at Purdue University, nuclear pharmacy is a specialty area of pharmacy practice dedicated to compounding and dispensing of radioactive materials for use in nuclear medication procedures. Nuclear pharmacy, developed after the specialty of nuclear medicine, was recognized by the American Medical Association. With the increase in the use of nuclear products, it became evident that individuals were needed to prepare these products. Larger hospitals were able to accommodate this activity. However, many smaller hospitals did not have the staff or capability to handle the radioactive materials, resulting in the conception of centralized freestanding nuclear pharmacies. When an order or prescription is written and presented for a particular radioactive product, it is entered by the pharmacist, just as it would be in a traditional setting. The pharmacy technician, taking specific safety precautions, prepares the product as ordered. The final product is checked by the pharmacist and dispensed or shipped to its destination using proper procedures to reduce the risk of exposure. Radiopharmaceuticals are a special class of drugs used in the nuclear pharmacy. The Mayo Clinic defines radiopharmaceuticals as agents used to diagnose certain medical problems or to treat certain diseases that may be given by mouth, injection, or placed into the eye or the bladder. The University of Arkansas, the University of New Mexico, Purdue, and Ohio State University currently are the only schools that offer a training program for nuclear technicians. Since the early 2000s, the National Associations of Boards of Pharmacy, the NABP, has included telepharmacy in its Model Pharmacy Act defining pharmacy practices. The Model Pharmacy Act, updated every August, provides the boards of pharmacy with model language that may be used when developing state laws or board rules. The NABP defines telepharmacy as the provision of pharmaceutical care through the use of telecommunications and information technologies to patients at a distance. A telepharmacy consists of a centralized pharmacy where the pharmacist is located and community pharmacy where the technician is located. The centralized pharmacy is connected to the community pharmacy via audio and or visual technology, allowing the pharmacist to communicate with the technician while remaining in the community pharmacy. The technology also allows the pharmacist to communicate with the patient and to check and verify the prescriptions being dispensed. Pharmacy informatics is a special practice of pharmacy that focuses on the use of information technology and drug information to optimize medication use. With the requirements set forth by the government to help reduce medication errors through the use of technology, informatics has become an increasingly important field. No additional education is required for the position of pharmacy informatics technician. However, most employers look for candidates with a bachelor's degree, preferably in computer science, and a knowledge of pharmacology. So again, you're more than likely not going to get a job working in that part of pharmacy unless you have a bachelor's degree in computer science. A minimum of 2 years experience in a community or hospital pharmacy is required for a prospective candidate in pharmacy informatics. So this is definitely something that, if you start out in pharmacy, you can maybe work in the pharmacy for a couple of years. If you have a strong interest in computers and IT, you can go back to school for your IT degree while working in pharmacy still. And when you're done, you probably are going to make maybe double what you're making or triple. I know a few friends that have went this route and they did pretty well for themselves. So lead pharmacy technician, this position requires national certification, proven leadership skills, and an experience as a working certified technician. So some of the daily responsibilities are interviewing, identifying, and assessing baseline skills for technicians, scheduling training and task assignments for the technicians in a department or even multiple sites, performing audits for compliance such as USP, patient safety, and quality to ensure optimum workflow, serving as additional team member when department is short of an employee or as a workload requires. In some states, technicians can check another technician's work in certain dispensing situations, and we call this tech check tech. In North Carolina, for instance, a lead technician could check another registered technician's filling of floor stock or unit dose medications in a hospital setting. Advances in technology are making new medical treatments ever more available. A growing population of elderly requires more medications, and the healthcare industry in general is rapidly expanding. As a result of these factors, pharmacy technician employment is expected to continue to grow as new treatments are discovered and new technology is created. The role of the pharmacy technician will also evolve. Education and experience are common requirements for the current and future practice settings of pharmacy. Professionalism is the most important characteristic of a candidate seeking any healthcare position.